Good morning, good afternoon, and good evening, and welcome to the International League Against Epilepsy's webinar series. I'm very excited to introduce our panel of speakers today. We've got myself, Professor Gus A. Baker. I'm a professor of clinical neuropsychology, and I'm Secretary General of the International Bureau for Epilepsy. I'm one of the co-conveners, and the other co-convener is Dr. Venus Tang. Venus, would you like to introduce yourself?
Hi, everybody. So welcome to this webinar. Venus Tang, I'm a clinical psychologist based in Hong Kong, and I'm interested in looking into the psychological aspects of epilepsy. So I'm very happy to have this chance to co-host and organize this webinar with Professor Gus Baker, and we have two great speakers today. So thank you very much, everybody.
Thank you, Venus. And of course, next is Professor Nuran Aydemir. Nuran, would you like to introduce yourself?
Hi, everyone. I am Nuran Aydemir. I'm a health psychologist. I work in the University Department of Psychology, and I'm also interested in the social aspects of epilepsy, and I'm very happy to be with you here today.
Thank you. And the star of the show today is Leonie Wollscheid. Leonie, would you introduce yourself, please?
Hi, everybody. I'm Leonie. I'm 25 years old from Germany, and I have epilepsy since 11 years. So, yeah, and I'm very happy to be here and thankful to have the opportunity to speak.
Thank you very much. So the way this webinar series has been set up is that Professor Aydemir will take the opportunity to talk to Leonie about her experiences during the diagnosis of her epilepsy. And we'll have an opportunity at the end to ask a series of questions in relation to that. So I'm going to hand over to Nuran and Leonie. And we're very excited about what you have to say. Thank you.
Hi, Leonie. I'm happy to be here with you, and thank you so much for accepting the interview. And if it's okay with you, may I start our interview now?
Yeah, sure.
Okay. First, I would like to ask you, you said that you were diagnosed when you were 11 years old. So I would like to ask you, what was on your mind when you first diagnosed with epilepsy?
Oh, sorry. Maybe I said it wrong, but I was 14, but it was 11 years ago. So, but it's a really hard one because I had my first tonic-clonic seizure in 2013. And until 2015, I had many tonic-clonic seizures and also focal aware seizures. And I was in pediatric care until I was 16, and they never diagnosed me with epilepsy. They just said she has migraine with seizures, and it ended in status epilepticus. And so when I was 16, I changed to an adult neurologist, and she diagnosed me with epilepsy, which was clear because I had a lot of seizures and symptoms and also epileptic potentials in my EEG. So as it was a long journey, I never had a moment like, oh my God, I have epilepsy. It was kind of a process of accepting there is something in my life. And also in 2013, when the tonic-clonic seizures started, I was 14, so I was in puberty. And that's a really hard time for a girl. So I was ashamed of obvious seizures and taking pills and going more to doctors, hospitals. So yeah, it was really a hard time. But when I got older, I decided to take more care of epilepsy, and I had so many thoughts, especially about the future, and a lot of fears. But I guess it's very important to keep in mind that this process is very individual. I guess normally the diagnosis would be a lot faster. So I guess there are some people who really have this moment like, oh my gosh, what should I do now?
Yeah. Yeah. And I would like to ask you, when you first diagnosed with epilepsy, do you remember the amount of knowledge you have about epilepsy? And how did you learn about epilepsy later on?
In fun fact, the pediatric neurologist gave me already in 2014 a booklet which said living with epilepsy. So I never was diagnosed correctly, but I had this booklet and I got some information from there. It was a German booklet, small one. And the adult neurologist gave me then information and also contacts for NGOs or self-help groups. But most of the information I got from the internet. I Googled a lot and looked on websites from NGOs because they have a lot of booklets to download and stuff. And at the age of 18, I really started to collect more information and also joined a German epilepsy organization. And a year later, I was working with the IBE already. And in 2022, me and 7 other young advocates founded our own organization in Germany. So we want to help people in this situation and also their carers.
Yeah, it's so impressive, all the things you have done. And I would like to ask you, when you diagnosed and afterwards, did anyone tell you about the issues that you need to be careful while you are living with epilepsy, such as driving or operating a machine or swimming or motorcycling? Have you received any information about these issues by a healthcare professional or by someone else?
Yeah, I guess the doctors were telling me when I was 15, 16 about the risk of driving or having a dangerous job, like, I don't know, police woman. And that's a fun fact, that was my dream job when since I was a child. So, but it's not allowed to be a policewoman with epilepsy. So yeah, driving is always a huge topic at like every neurologist visit. So yeah, that's clearly something they talk about. But sadly, I was never informed about ZUDEP, which I think is really important. Many years after the diagnosis, I guess like 6 years later, I found out on Instagram about ZUDEP. I never heard of it before. And I guess that's something a patient shouldn't found on Google or on Instagram. Yeah. And I guess it's very important to tell the people.
Yeah.
And of course, they told me about all the risk about missing medication or having triggers like alcohol and something that it can happen that I will have a status or something, but never this topic came up.
Yeah, yeah. Actually, I'm glad that you mentioned about SUDEP, because in our clinical practice, we also know that neurologists usually avoid this topic and do not give information to the patients about SUDEP and the risks of it. So patients usually learn it in the way that you learn, actually. And it is not a good way to learn. I think, yeah, I agree with you.
Yeah, I think, maybe
please.
I can add something. Yeah, I think it's also a little bit dangerous for the patients to sit there on your couch and Google for it and find some information about ZUDEP and feel completely helpless. And you might have a visit in 3 months at your neurologist, and then left alone with this information can give a lot of fears. So
yeah. I would like to also learn Professor Baker's idea about what do you think, Gus, why usually health professionals avoid to give information about SUDEP to patients?
Yes, I mean, it's very difficult to think about how you introduce a subject where you're actually thinking about having to tell people that they're at risk of death as a result of their seizures. And I think we probably need to actually tell people when they're capable of receiving that information. So if, for example, you might not want to tell a young person that, but you might want to certainly discuss it with their parents, and you want to make sure that that young person, when they're old enough, understands the risks associated with epilepsy, particularly the sudden unexpected death issue. So, but obviously for adults, I would say you probably need to introduce it fairly quickly after the diagnosis. But it's one of these pieces of information that people need to be constantly aware of. So it's something that should be discussed along with all the other risks associated with epilepsy.
Yeah, thank you so much. And Leonie, I would like to ask you, has any health professional discussed with you about the cognitive problems that you can experience while you are living with epilepsy, such as memory problems, concentration difficulties, and the side effects of anti-seizure medication on your cognitive abilities? Did they mention all these issues with you?
It's a really short answer. No, nobody told me about this. And I think it's really sad because I had a lot of cognitive problems since I was having these tonic-clonic seizures, and also since taking medication. And before, I was really good at school. And then my grades went down. I lost many interests, and I also wasn't able to learn that much than before. Like, I was interested in languages and it was very easy for me, but then my memory and concentration got worse over the years. So yeah, and nobody told me, and you feel like you're stupid because you don't have the ability more to do it that way you did before. So it's really sad. It's also sad that nobody takes you serious when you say, I have these problems, and they are like, okay, yeah, but we can't do anything against it, and you being left alone with this, and then yeah, it's really hard to keep up with others.
Mm-hmm. And how you overcome all of these issues? Because you're an engineer, and it's a quite difficult thing to accomplish, by the way. So you somehow managed to cope with it.
Yeah, I guess a good management of the epilepsy was very important, like getting enough sleep, and also having a lot time for myself to calm down and do some relaxing stuff and not to stress that much, which is of course easy to say, but not easy to do.
Yeah.
But I learned over the years how to make good notes, how to write some sentences I can remember, or some different, I don't know, like graphics or something that I can keep in my mind much more easier than other stuff. So it was also a very long process.
Yeah, I'm sure. And I also would like to ask you, did any health professional mention you about the mood issues that you can experience, such as depression and anxiety, while you are living with epilepsy?
It's the same answer than before. Sadly, no.
Sadly, no.
I mean, I can laugh about it, but I was like, when I was younger, 16, 17, I had a lot of mood swings, and they are like, it's from puberty.
Yeah.
But when you are an adult with 18, 20, and you still have those really weird mood or other problems, yeah, you're like left alone, and then or maybe other people mention, okay, that's not puberty. And I think it would have been really nice if there was better help or an earlier help for this.
Yeah, and now I would like to ask Dr. Tang, because she is a clinical psychologist and she is quite experienced in the mood issues in epilepsy. what is your professional idea about this, Venus? What should be done?
Well, yeah, I think first of all, the awareness is very important because I also want to ask Leonie to follow up a little bit on these questions about cognitive issues and also the mood issues, because she mentioned that there is nobody actually mentioned to her about the possibility of having cognitive complications and also mood complications. So when you experience these complications, did you actually associate this issue with epilepsy, or did you just feel that it's becoming weird in your life and you can't handle your mood and you suddenly have a lot of cognitive issues, memory problems, and your grades drops, etc.? Did you associate this with epilepsy and talk with your physician about this?
Oh, it's really hard to remember because it's such a long time ago. But I think I talked to my pediatric neurologist, but as you know, as I told, he never diagnosed me with epilepsy. And so he said, no, you only have migraine with seizures, so you cannot have like concentration problems, and that's that's not possible. So he was like talking it down, and he didn't take it seriously.
So you felt that your issues are being like underestimated and not being seriously taken.
Yeah.
Right?
But I guess in that case, it's also because of the wrong diagnosis. So it was really complicated. So I don't know. So it might be different for people who were directly diagnosed with epilepsy.
Yeah, I get this. So what Nuran asked is a very important question, is that it's very important to raise the awareness in the very beginning so that people with epilepsy know that it is possible that they also experience cognitive issues related to epilepsy, and that they can also have mood issues related to epilepsy. In my experience is that some people do experience mood complication, but they think that it is a separate issue. So they do not actually report to their physician. So the physician basically didn't know that they have these mood issues. So when I ask them in the interview, they just say that, well, they experience those mood fluctuations and also memory problems. But then when I try to let them know that this can be also a manifestation of epilepsy, they felt shocked. They didn't know that epilepsy is something besides seizure. So I think it's very important for those who have those who are being diagnosed with epilepsy to know in the very beginning that these can be also a symptom and also a manifestation of epilepsy. So this is my thoughts.
Yeah. Thank you, Vin, so much.
Thank you.
And Leonie, I would like to ask you, can you describe a little bit us about how epilepsy affects your life, such as your work, your education life, your romantic life? And I would like to ask also, have you experienced a difference from the 14 years old and now, and how it progressed for you?
Okay. So like I said before, in school and university, it was very hard to concentrate and to keep everything in mind, to have these exams, and also to keep up with others. And it's nearly the same for the job, because I have to make many notes or need sometimes the information more repeated than others. And the tiredness from the epilepsy itself and also from medication make it worse. And also I experience sometimes fatigue, which is also nothing. You can have a good sleep or something. It's there. You can't do anything against it. So like I told you before, it makes me feel, stupid sometimes. And yeah, due to the low energy I have, I'm often tired. I can't stay up that late, so I'm not that active anymore. I have less hobbies, so I need more time to regenerate from a work day. And so I'm not working full time, only 32 hours instead of 40 hours. And yeah, I guess for the relationship side, that's a difficult one, and also an individual. For me, I got more distance to my parents due to many things that happened because of the epilepsy. But when it comes to my partner, there's nothing which influences our relationship. He's sometimes a little bit of fierce, but yeah, nothing serious. But I guess when it comes to affecting my life, there's also one good point. With the organization I founded, with the other people, I got stronger. I grew more or a better network of people, and also that's the reason why I'm here. I went to the IBE and I knew Gus, and he asked me to do this and so on. It's kind of growing bigger and bigger, and also for your own, I guess it's a little bit good aspect of this. And you had a second question. Can you repeat this, please?
Of course. Do you think the way you cope with life with epilepsy has been evolving to a better one when you, based on your experience with epilepsy?
Yes, I think so. Because also the needs change over time.
Such as?
Like when you're a woman, you have to think about contraception, pregnancy, and all that stuff. So this is one specific thing for women, of course. But when you're 14, you might not think about that much about pregnancy when like you are 25 or 30. Also, the acceptance of the side effects of the epilepsy and the treatment change, because maybe when you're 14, you're like disgusted by the rush you get from the medication, but when you're older, it's like, okay, I have to accept this. Or also tiredness or less libido, which is like a problem, I guess, which is not often talked about. Also the way of thinking about other treatment options like surgery. When you're 14 or 15, 16, you're like, oh my gosh, no, never, I will get surgery on my brain. But the rational thinking get better and better, and you get a clearer view. And also, of course, a better epilepsy management, which makes it much more easier to live. And I guess, or maybe Venus or Gus can talk a little bit about the transition care of people, or what do you experience in your practice when young people are going to an adult neurologist? That would be really interesting, I guess. So it's also a change of needs.
Yeah, definitely. I would like to ask you, do you have a transitional clinics in Germany for people with epilepsy, such as from adolescence to adulthood? Because I know Netherlands has it. Do you have these kind of clinics?
No,
No,
I don't think so. No.
Gus or Venus, would you like to speak a little bit about this transition process?
Yes, I mean, it is certainly in some countries and in the UK, that there is a well recognized understanding that there has to be a transition period from a child to an adult in terms of the management of epilepsy. And there are a number of initiatives across countries that to try and do these clinics where the handover becomes much more smoother. And I think the difficulty is for many many young people who go from being in the in a child neurology service to an adult neurology service is the expectations of them when they enter the adult clinic, which is basically you have to take a much more proactive involvement in the management of your own condition, whereas previously your condition was managed by others, including your parent and your neurologist and if you have an epilepsy specialist nurse, then the epilepsy specialist nurses. But I know from our understanding of the way that epilepsy is managed globally that there are many, many countries who will not have that transitional services, and it makes therefore a greater challenge from moving from a child to an adult neurology service. Venus, what's the experience you have from your region?
In my setting, we have this transitional service, but I totally agree what you said is about the expectation of the management, because as a pediatric patient, sometimes they experience difficulty, for example, in schools. We will take a step further to discuss that condition with school, for example, the exam time, the homework, workload, etc. But then when they transit to an adult service, they also experience a lot of issues, for example, at work, but no one is going to explain the condition to their employer. So this is what they need to manage their own condition in a wider perspective. And this is also what we talk about self-management. They need to plan about their employment. They need to they need to learn how to explain their condition to people around them. So it is this is a completely new skill set that they need to learn as an adult epilepsy patient.
And you and I have talked about, Venus, the importance of making people ambassadors for their own condition, so that they really do understand their epilepsy, they understand the treatment they have for epilepsy, they understand the risks associated with their epilepsy, and they understand how the best way to manage those risks are, and basically to manage their epilepsy. And that's something that I think as clinical psychologists we recognize is an important step that people have to take, but it's not always an important step that's supported by services.
Yes, I totally can relate to what Leonie said, because she learned a lot of information from the internet, and this is not ideal. This is not ideal.
Yeah. Back to you, Nuran and Leonie.
Thank you so much. And Leonie, I would like to ask you, have you ever felt that you are being treated differently by other people just because you have epilepsy, such as, have you ever felt that they are underestimating your capacity because of your epilepsy, or they are giving you less responsibilities when you are not asked for? Or have you ever felt that they are overprotective toward you because of your epilepsy?
Yeah, sometimes it really depends. Like my parents were overprotective, really annoying overprotective. But if I don't tell the people about it, they don't know that I have epilepsy, because it's an invisible illness. So I'm not being treated different. And it was the first time in my current job that I opened up and said I have epilepsy, and it went really bad for me because my boss was really discriminating. So for me it was a lesson like, okay, I won't tell it to a boss or someone like this again. But it's also again very individual, and also like, how's your relationship to the person you're going to tell this. But I also know if some people know that I have epilepsy, they start worrying when I'm around them, like, oh my God, what's going on? Or what should we do? Or even if you would tell them what they could do, they would worry. So that sometimes, it also depends very on the person.
Yeah.
And of course, maybe a little bit a different view. I'm treated different by doctors sometimes. They make me feel like I'm stupid or treat me like I'm stupid. So it's really hard sometimes to keep a good conversation up, but then afterwards I think I can prove often enough that I'm not that stupid. So that shouldn't be sound arrogant, but I think it's sometimes really unfair.
Yeah.
Yes.
Yes, you're definitely right. And I also would like to ask you, you are living with a chronic illness, and you mentioned a little bit earlier, but do you think your needs while you are living with epilepsy change over time?
Yes. Okay. I guess I talked already a lot about it. So yeah, for me it was of course the women pregnancy contraception thing, which was really important. Also that the doctors are talking to you about it. Also because of some medication you shouldn't take when you want to get pregnant or something. So they wouldn't talk to you about it when you're 14, but more when you're like 16 or 18. And also I feel like that the change in needs is always coming with the periods of age, like puberty, and then you're working or university working, and then maybe when you're an older person. So I guess it will always change. Also depends on the situation on life, like having your relationship, having a job or not having a job, and also of course about mental illnesses, which changed over time. And I guess there is a big change of needs in it.
Mm-hmm.
I hope it's got clear what I mean with the mental illnesses. Okay.
Yeah. Neurologists, they told give information about the contraceptive use, because some contraceptives shouldn't be taken with anti-seizure medications. And have you asked them, or did they tell you in advance?
No, they told me in advance. It was the one who never diagnosed me with epilepsy, but gave me epilepsy medication.
Finally, he had something good.
And he just said I can take the contraception with this anti-seizure medication. That was like one of the first things that came up with my first or second tonic-clonic seizure. So yeah, that was really good in a way that they came up with that. But all neurologists I met until now did this. So they always ask for contraception or also the pregnancy.
Yeah, good. And I would like to ask you a last question. Given your experience with living with epilepsy, if there's a chance to go back in time, what would you like to learn more at the beginning of your diagnosis?
Yeah, that's also really hard because it's more a wish that you could learn more about the problems that can occur, like mood or cognitive issues, and also what to do against it, like not having depressions for years and it's not being treated. So that would be really nice to have more help and support in this.
Yeah, because you're an advocate at the same time, your opinion is quite important. What would you advise the healthcare professionals in the epilepsy area to discuss with all newly diagnosed individuals with epilepsy?
I guess, yeah, there are a few things like please inform your patients about all the risks and issues. And I mean, all the risks, also SUDEP. I mean, you don't have to say like, you have epilepsy and you can have SUDEP and die. That's not the thing you should do, but you have to talk about them to have a based relationship between patient and doctor. And for me, like also from my own past and also from other advocates I know, support the patients and listen carefully, take the patients and their side effects more serious. Also, if they can occur due to medication, if they started a new medication and they have mood changes or something, don't say, okay, it will go away or something. No, take it seriously, like depression, anxiety, or suicidal thoughts and fears. That's so important. And also give them contacts for self-help group or for more information, not that they are Googling alone on their couch at home. And for me, like the last things I'm saying now, for me, one of the most important things is talk to patients at eye level and ask them what they want. That's so important for a good relationship and also for openness. And for the end, a quote from my neurologist, he always say, you have the last word, you are the boss of your own body.
Yeah. Thank you so much. And I would like to ask Gus and Venus, is there anything that you want to add?
Yes.
What they were saying.
A question for you, Leonie. I mean, you're different from quite a few people in that you're very intelligent and you're clearly, you clearly have a lot of autonomy. One of the things that I was listening to when I was listening to your story was about the fact that you went on lots of Google pages and web pages to try and find about epilepsy. How often did you find that information useful?
Oh, that's really difficult because mostly it's some theory, and yeah, I mean, it didn't bring me that on, but on that one page from that NGO where I found some young also advocates, that was the one helpful thing which started my advocacy journey. So yeah, I mean, it's really difficult because when you look at different websites, you find different information, which is also very dangerous about some specific things like also contraception or something like this.
So Leonie, we have to be honest, and I have to say that you and I have worked together on information for the IBE website, and I'm sure you're going to agree that what's really important is that organizations like the ILAE and the IBE provide reliable and valid information that people with epilepsy can access, so that that they get the right sort of information delivered in the right way, in a way that's going to be useful for them.
Yes, that's correct, because there are a lot of websites which are more private, but the bigger ones or the NGOs are able to have information or keep up information or let the information verify by medical professionals or something. So that is very important. I guess it's always important when you Google to have a resource which is reliable and also honest, and yeah, I guess that's.
So let me, I'm going to ask you some more stuff, but let me hand you over to Venus first, and Venus, over to you.
Thank you. Said there is a point where you started to join in the German epilepsy organization, and then a year after that you started to serve in the IBE, right? Did I get it correct? Okay.
Yeah.
So, yeah, I'm very interested to know, how did you know about the German epilepsy organization, and then what made you decide that you need to join in? And can you describe a little bit how it made a change to you? Because obviously now you cope with epilepsy, and then you become an epilepsy advocate. So how did it make a change in you by joining these organizations?
Yeah, I guess when I was 19, I joined the German organization. I found this online. They had a youth group, and I thought, why not? Because I never met anyone who had epilepsy in this time. So yeah, I joined them, and it was really nice to have the opportunity 1 year later to join a workshop in Dublin from the IBE for young people. And yeah, it gave me so much self-confidence also in speaking, and also that my voice is important. And I mentioned so many changes in the way I was having a view on different things, a clearer view, a better view. So it let me grew very good for speaking, and also being more open, because I was very, very shy. And so it led me to a more open person. Was there another question you've asked, or is it all answered?
Yeah, I'm digesting, because you're very impressive to me, because you cope with your epilepsy conditions, and then you became an advocate. And what I wanted to let people know, one of the message is that it's very important for you to be open to these kind of organizations, so that you can meet people with similar experience, and also you can share the experience and know that your voice can be heard by other people, including healthcare professionals, like in this kind of platform. So I think it's not just to you, but all the other people who join this kind of epilepsy organization can get this benefit. But in some places, this kind of organization may not be so approachable, or it is not easy to get access to this type of self-help group. So maybe one of the useful way to promote epilepsy self-care, maybe this is also one of the direction.
Yes, I agree. I totally agree. And there are so many programs and groups which are online because of the COVID, and also for the worldwide connection, like from the IBE youth group. We have some people from Australia, from the USA, and so we connect all over the world and can talk. And one of the big advantages is like we don't talk about epilepsy all of the time. That's not the thing of a self-help group. You're like, oh my gosh, my day was so bad. I don't know, my food was very bad or whatever. You're just talking, and that's so nice and really helpful.
Yeah, because you also mentioned about self-confidence. I think this is where you also get self-confidence from this kind of interaction. In my clinical experience, is that some people who have epilepsy, they do not get to know people anymore. They feel that they are different from other people, and they also feel that they're being treated very differently because of their epilepsy condition. So if you can get a step further to join this organization, it would be very helpful.
And yeah, and I guess it's proven that being social or having more contact, social contact, friends, partner, family that are supportive are, or the people have a better management of the epilepsy when they have a support environment.
Yeah.
So, Leonie, can I just ask you, how did your family cope and react to the diagnosis of epilepsy?
That's really a bad one because my parents still believe I don't have epilepsy. They couldn't accept this. They were like, no, you're fine, you're going to be fine. And they always ask, when can you stop taking the pills? They asked this to the doctors. They weren't able to accept this. So that was really hard for them, also for me. So yeah, it was very difficult. and it's still difficult because when you have to listen to always these sentences like, oh my gosh, you're taking so many pills or something like this, it's not helpful. But you try to, or I try to avoid the contact. So, I mean, it's not the best way, but for me and my life, it's the better way. So
Right.
it's not a very good example right now from me, but I know from other people that they have very supportive environment, supportive family and friends, but also of people who lost friends due to epilepsy because the friends were afraid, or they thought, oh my God, she's a freak, or we don't want to be in touch with her because I don't know, she's not able to stay up until 2 a.m. or something like this.
Yeah, so it's been a journey, but not an easy journey for you.
Yes.
Yeah, and I think I get the impression that in an ideal world, it would have been helpful for you to, say, have access to someone like myself or Dr. Tang, to have the opportunity to discuss those difficult issues, particularly in relation to the management of your epilepsy.
Oh yeah, I guess when you were first diagnosed or having a tonic-clonic seizure, it's very important to get mental health support, because after the first tonic-clonic seizure, I mean, you're always scared because you wake up in a hospital or whatever with a bloody tongue and I don't know, headache, and you were unconscious. So yeah, it would be really good to have mental health support at this point. But
Good.
not only for newly diagnosed people, also for the people who are already diagnosed for like years, they also often need mental health support.
Yeah. And what Leonie said, I think is quite important, the parental attitude, because in my experience, when you say parents that your child has epilepsy, they start to do what I call doctor shopping. They are looking for a doctor who say, this is a wrong diagnosis, your child is just having a weak body and it will be okay if she takes some vitamins. But the parental attitude is critical to the adaptation of the child for the condition. So I think what you said is quite important, and also we need to educate, we need to deal with the reactions of parents, and the neurologists also take the reactions of parents seriously.
Thank you, Nuran. Okay, I think we've got an opportunity to ask some questions. And the first question was from Dr. Wadia about despite having modern research and pouring millions of billions of dollars towards it, are we failing to cure it permanently? Are there any possibilities of profitable cooperation with corporate stakeholders and healthcare professions? And are we failing to understand the epileptic or seizure medications have same chronic diseffects on human body like substance abuse? Knowing this, professionally randomly told to patients to take their medicines daily. Dr. Tang, would you like to try and answer that question? Because I think it's outside our remit to be able to address this well.
Yeah, I agree. Mm-hmm.
I think, Nikhil, that these are really important questions, but these are questions for the epilepsy community, and which is about how do we actually make epilepsy a #1 priority for healthcare, particularly when compared to other conditions, it receives substantially less resources. And how do we make sure that people with epilepsy are treated appropriately with the right medication and the right diagnosis, and they have access to neurologists and healthcare professionals working in the field. And that's a challenge, I think, that's been around for a long time, and one that certainly International League Against Epilepsy and the IBE, the International Bureau for Epilepsy, are working very much towards trying to resolve. And there is some very significant initiatives at the moment trying to make epilepsy a priority for global medicine. Now, there's a message from Zamir Fakir, where it says, was there any adverse birth insults or febrile seizure spells in your life? Which, I guess with such a long time having epilepsy, you must have asked about your parents. That's a question for you, Leonie, if you want to address that.
Yeah, so no, I didn't have any seizures when I was younger, a child or something like this. And we don't have a family history of seizures or epilepsy. So I was like picked randomly.
Right. Yeah. Okay.
I want to add a point, because in some culture, people can, it can be difficult for people to believe that epilepsy came randomly. They just search for different reasons behind. They think about anything that they do wrongly when the child was young, so that it lead them to have epilepsy, or the misbelief. So I think it's also very important to include this in the education, is that epilepsy can actually happen randomly in a person who do not have any family history. So it's in some cultures, it's just difficult for people to believe that it's random.
I think it's fair to say, Venus, isn't it, that we, as psychologists, we know that people have to make sense of their stories.
Yeah.
And they have to have a definitive explanation for what has happened to them. And so in the absence of providing good information about epilepsy and how what's its causes, it does lead to have people developing beliefs that are not particularly helpful and actually are completely unhelpful. So I think this education is really, really important, not just of the people with epilepsy and their families, but to a degree to the community that they live in.
Yeah, totally.
There's a question that's just put up. I have a question. I have an epileptic seizure, and after I married, my season was raised. What is there's a reason? I'm afraid I don't quite understand the question. Have you got it in front of you, Venus?
She just asked, her seizures started after she got married, and she's asking whether there's a specific reason for this or not.
Thank you. Nuran, would you like to answer that question?
Actually, this question is quite interesting, because in clinic we also see this. In the males, we see that their seizures are started when they start to do their military service, and in females, their seizures started when they got married. Probably it's all these stress and difficulties may sometimes, I think, underline the issue in the brain, and it become on surface. But I don't have a clear answer. It is something we also observe in our clinic.
I think you're absolutely right, Nuran, that stress can be a significant trigger for seizure activity. But I think what we probably say in this particular case, that in order to answer this as an individual case, we'd need to know a lot more about the person's circumstances. We'd need to know a lot more about the seizures. We need to know about the family background. And what we try to do is to form an understanding of what a person's situation is in order to be able to help them make sense of these sort of questions.
Yeah, definitely.
There's another question from Godana Kativa Prevenchka. Do you think that neurologists using the NNDI-E for screening depression in people with epilepsy Venus, tell us about what your colleagues do in your region.
NDDI is a very popular screening tool for epilepsy, and that is developed particularly for epilepsy patients instead of any other screening tools for epilepsy in general. And it is also very handy. It is just 5 questions and one very important question on suicidality. So in my community, we have translated NDDIE in Chinese, and we are promoting this. So a lot of neurologists started to use it, and I know that in many regions, this is also one of the very popular tool for screening of epilepsy, depressive conditions in epilepsy as well. So how about in the UK?
So I think using screening tools is a really good idea, and I think that there will be a lot of variability across the country about whether it's used or not. But I would say that it's certainly a good way of actually identifying people at most at risk from depression. And you know, depression is a part of, maybe a part of the epilepsy. It might be a reactive or endogenous depression. And I think we probably have a duty of care to manage that as alongside the seizures as well. So yes, I think it's a good idea. Okay, and there's a
one more comment is that in paper published and that even we do not have time to have a full screening tool for one question regarding mood in follow-up, in clinical follow-up, for example, can you describe your mood recently? So this would be helpful for patients to start talking about their psychological condition in the clinic.
Yes, we know that there is a difficulty about identifying issues for people with epilepsy in relation to how they manage their condition. You know, the prevalence of anxiety and depression and low self-esteem and the consequence of stigma. There's a bigger issue for me, which is screening them is really important, but the next stage is equally important, which is, have we got the services and resources to help people with managing those? And we know that there is we know that we fall short of providing other health professionals rather than neurology and epilepsy specialists, nurses and the management of epilepsy, and there needs to be more support, and that's either through the appointments of psychologists or neuropsychologists, or a greater engagement of the NGOs that might be able to support people.
Yes, definitely.
Nuran, is that experience in your own situation?
Yeah, we have to use actually some scales, but as you stated, there's a huge variation among countries because of the reliability issues, and so but we have to use it, otherwise we don't have that much time to deal with every issue with the patient. So they're practical and they have a standard. So yes, we do use it actually in our clinic too. And I think our time is
it is up. Yes,
yes, it's up.
Come back onto the screen, please.
Yes, Leonie.
Thank you so much, Leonie, for spending this hour and being open and honest and intellectual and sharing your journey with us. The IBE is committed to making people ambassadors for epilepsy, and you are just one of those people who are so good for the world of epilepsy, so good for the IBE. And if we've helped you with your shyness, that's the least we can do. So thank you very much. Thank you, Nuran, for your excellent interview. Thank you, Venus, for sharing this co-convening. And thank you for everybody who's listening. We hope that you have found it interesting and useful and as enjoyable as we have on the screen at the moment. So thank you very much, everybody. Stay safe and have a really good day.
Leonie, danke schön.
Thank you.
Thank you.
Thank you.